Good afternoon, and thank you for joining us for the Tuesday, June 29th briefing. Today, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, and subbing in for Dr. Weston, we have Dr. Joyce Sanchez, the Infectious Disease Specialist and Director of the Froedtert and Medical College of Wisconsin Travel Health Clinic and Assistant Professor of Medicine with the Medical College of Wisconsin. Thank you for joining us. And County Executive Crowley, I'll hand it over to you to get us started.
Are you sure that's not Chris Middleton?
Well, thank you so much, Kat. Thank you, Mayor, and good afternoon to everyone. First, I want to say, as we continue to see COVID infection rates decrease and our vaccination rates rise, our Milwaukee County transit system will be lifting its passenger capacity limits starting this Thursday, July 1st. So MCTS has had a few different passenger capacity restrictions in place since the start of the pandemic. And at one point, we only had 10 passengers that were permitted to be on board. That number later changed, grew to 15, and then eventually 20, where we are currently at and have been for the past few months. But now the time has come to return to full capacity for the first time since April of last year. And so returning to full capacity on our buses allows the Milwaukee County Transit System to better serve those who need reliable on-time transportation in order to get to work, school, the medical appointments, the pharmacies, grocery stores, and other important destinations. So this adjustment to the bus capacity limit also aligns with national transit trends, reopening plans, and relaxed guidelines from health officials. But I want to remind passengers that masks are still required on board on any public transportation throughout the United States, regardless of your vaccination status. And this is a federal mandate, which means it supersedes any local or state mask policies out there. So please help out our bus drivers and fellow passengers by simply wearing a mask while you're on board the bus. And if you forget yours, free masks will be available on every bus. So thank you ahead of time for doing your part. And as we see these optimistic COVID trends have also really led us to our next phase of reopening with amendments to 2 county administrative orders. So as of Thursday, July 1st, indoor settings at county facilities may operate at 100% capacity. Physical distancing and other risk mitigation measures are largely unchanged in this amendment and should continue to be observed per the minimum requirements outlined in the order. And we will continue to require reopening plans for services or events reopening in fully or partially indoor spaces. Again, face masks are still required for employees and members of the public when they are inside our facilities. However, fully vaccinated members of the public are not required to wear masks at private events held at county facilities, and the county will not require proof of vaccination status in these instances. But we will continue to ask our employees and our contractors to wear masks in these settings, regardless of their vaccination status. So thank you, as always, for your continued service and commitment to keeping our services running and our employees, as well as community members, safe throughout this pandemic. Next, I'd like to share a little information about our community mobilizer opportunity that the county and the city of Milwaukee are supporting. And one of our community collaborators, Lorraine Lathan, a founder of Jump at the Sun Consultants, is leading efforts to support grassroots COVID outreach and is actively seeking more mobilizers to champion this effort. And this is a paid opportunity, and COVID mobilizers can earn up to $2,000. So if you are interested, interested individuals can attend a paid training session this Wednesday, June 30th at 3 p.m. And so if you want more information, go to jumpatthesunllc.com to register. Again, that website is jumpatthesunllc.com to register. And so this opportunity is open to individuals aged 16 years of age or older. And the last thing I want to touch on is the 4th of July is this weekend. And I'm excited. This is an exciting time to celebrate our nation's independence, as well as spend quality time with our loved ones. And so I want to encourage everyone out there to continue to practicing safety guidelines, such as washing your hands as often, doing your best to avoid large crowds when possible, and wearing your mask when needed. And with that being said, I have to make sure that I say go Bucks, and I hope everyone has a fantastic 4th of July. And now I'll give the assist over to Mayor Barrett.
Well, thank you very much, Mr. County Executive. And you look great, just to be clear, you look great.
Thank you.
I'm jealous, in fact. Well, good afternoon, everyone. I'd like to begin with an update on our gating metrics. Last week, as the commissioner has stated, we dropped to the low transmission category for COVID-19 cases per 100,000 population. Today, as of today, we've seen a slight increase to 11.2 cases per 100,000, which brings us back up to the moderate transmission category. I was hoping I would never have to say that again, that we are now back up into the moderate transmission category. So we've got some work to do, but our percent positivity rate still remains in the low transmission category, and it's now at 1.1%. And our vaccination rates are 47.5% of City of Milwaukee adults, that's individuals 16 or older, who are fully vaccinated, and 52.6% of City of Milwaukee adults have received at least one dose. Why is this relevant? This is relevant. I just saw a newspaper article that talked about the fact that 95% of those individuals who died recently of COVID either were not vaccinated or were not fully vaccinated. So we absolutely know that the vaccinations and the vaccines save lives. And we're going to continue to work with our partners to do that. Everyone has a role to play in helping us increase our vaccination numbers. The Milwaukee Health Department has launched the Crush COVID Crew Ambassador Program in an effort to help us crush COVID in Milwaukee. Again, that's because I want to see those numbers, which are in the high 40s for fully vaccinated and low 50s for partially vaccinated. I want those numbers to go even higher. So our Crush COVID Crew ambassadors are Milwaukeeans who are passionate about sharing accurate and reputable information on the vaccine and combating the spread of misinformation in our community. And so that's one of the things we know is important as well. So today, the health department is holding 2 information sessions for those interested in becoming ambassadors. If you miss the 11 a.m. session, you still have time to sign up for the later session at 4 p.m. And you can do so by going to the Milwaukee Health Department Facebook page. To do that, again, it's pretty easy to find. Just go to Milwaukee Health Department and you'll see the Facebook page. In terms of our outreach efforts, last week through a variety of vaccine clinics across the community, we were able to vaccinate 90 individuals, 14 of which happened at the Pfizer Forum in advance of the Bucks game. I'm frustrated by that number because, again, I'm a Bucks fan, I'm a fan of the vaccines, and I want more people to take advantage of that because they have had these drawings that get you into the Bucks game. So it's beyond comprehension to me why someone wouldn't want to get in and see that game, the way they're playing, especially right now. In addition to utilizing the Northwest and Southside Health Centers, the public can take advantage of the following clinics on Wednesday, June 30th. Wednesday at Washington Park Library from noon to 4, at the United Methodist Children's Services of Wisconsin from noon to 4, and at Ascension All Saints Family Health Center from 1 to 5. Finally, St. Benedict the Moor from 4 to 6. All Milwaukee Health Department vaccination clinics will be closed for the 4th of July weekend in observance of the holiday. But you can visit healthymke.com to find a list of pharmacies and other locations that remain open for vaccinations. Finally, I know the health commissioner put out a statement on relating to comments that have been made by Senator Johnson and others. And I invite the media to take a look at the statement that has been put out by the health commissioner. I think it's an important statement. And with that, I'm going to turn it over to Dr. Sanchez.
Thank you for that. I have several updates on vaccine effectiveness and safety, the Delta variant, and some other COVID-related updates. The good news is that we've come a very long way, but we still have a long way to go. Studies of vaccine effectiveness in real world show that the 2 doses of the mRNA vaccines, namely Pfizer and Moderna, offer similar levels of protection against COVID-19, including severe illness as they did in the clinical trials of 90% or more. 2 doses do provide better, more durable protection than 1 dose. So it is still very important that if you want the most benefit of the vaccines, that you should get the full 2 doses of both of those vaccines, whichever one you choose. Studies of the 1-dose J&J Janssen vaccine also provide excellent protection against COVID-19, although there is less real-world data. to give precise statistics, and more information on that is to come. In regards to safety, the American College of Immunization Practices reviewed cases of a condition called myocarditis or pericarditis that has been linked to the mRNA vaccines. These are mostly in young men after the second dose of the Pfizer and Moderna vaccine. These cases were found to be extremely rare and so far mild and self-limited. The committee's ultimate statement has been that the benefits of these COVID-19 vaccines still far outweigh the risks of getting COVID-19 for all ages, even if you are a man in that age range. As far as the Delta variant, which is what is all over the news over the past few weeks, it has become the predominant circulating strain in many countries across the globe. It's known to be more contagious than previous strains of the virus, and its presence in the US is escalating. It's picked up from 2.5% at the end of May to about 20% more recently, and the doubling time continues. Most predict that it'll be the predominant strain over the course of the next month. Studies do show that vaccines that are available here in the US are largely effective against the Delta variant, though protection may be attenuated or somewhat lower if you're only partially vaccinated with one of the two-dose vaccines available. Data is still continually being gathered and updates are ongoing. But on to more fun things like the 4th of July. If you are fully vaccinated, the CDC does state that you can resume activities that you did prior to the pandemic. And this goes including without wearing masks or physical distancing, except where it is required, as mentioned by David Crowley, such as on public transit, buses, trains, airplanes, and certain other places where it may be mandated on the federal level or local level. But do so as you feel comfortable. And I say that due to nuances, particularly for those who are immunosuppressed, have suppressed immune systems, because vaccine effectiveness is still being understood in those people. Now, if you're not fully vaccinated, and this includes children who are not yet eligible for vaccine, it's still recommended to take precautions, particularly in indoor, poorly ventilated, crowded areas outside of one's household with others who may not be fully vaccinated. But most importantly, if you're not vaccinated, the best thing you could do is to get vaccinated as long as you're eligible, because immunity is how the globe will get to the other side of the pandemic. And we all want to return to the things that we want to do, including going to those Bucks games. Now, we are seeing an increase in non-COVID-19 respiratory viruses among children and adults. So I'll just conclude here that the viruses that we generally see every winter, like RSV or other coronaviruses that are commonly implicated in the common cold, has gone up substantially, even though we are approaching July 4th. This is most pronounced in southern states, but we're seeing it in Wisconsin as well. And just know that you can take the same actions and be proactive and make a difference by protecting yourself and others, by preventing the spread of those respiratory illnesses that can land susceptible people, including children in the hospital. And you can do so by washing your hands with soap and water, covering those coughs and sneezes, and please stay home if you are sick. If you have symptoms, please stay home, especially when it comes to summer camps, childcare programs, long-term health facilities, and other settings where there are unvaccinated people or those who are medically vulnerable. But otherwise, enjoy that July 4th that's coming upon us.
Thank you, Dr. Sanchez. We're glad to have you joining us today. And at this time, we'll move into the media Q&A portion of our briefing. Our first question comes from Rose Schmidt with CBS 58. She says, we're not going to meet President Biden's July 4th goal of 70% of adults vaccinated. What further can be done locally to bring up the numbers? And Mayor, how do you hope the Crush COVID efforts fits into this?
I think we can see now that we're basically at the time where we're in the ground war against this pandemic, that we've been able to get all those individuals who saw immediately the value of getting vaccinated. We also have done, I think, a very, very good job in persuading people who've been sitting on the fence to start moving toward vaccines. Now, as we look at the remaining 45%, we clearly have more work to do. And so the tack that has been taken by our health department, and both at the city level and at the county level with its mobile lab, is to try to bring the vaccines to people. I think a big part of this is having individuals who are trusted by those who have not been vaccinated. So that means, for example, for younger people between 20 and 30, who are the most trusted people? Not surprisingly, it's other people who are 20 to 30, who have the same values, who have the same, oftentimes, race, who have the same education. We have to have individuals in our community that those who are not vaccinated trust the most. And that's just a pretty simple goal. It's harder to effectuate that goal, but that is what we are actively trying to do right now, is to get as many people who know the neighborhood. You've got to know the territory. You've got to know the territory. And so having this ambassador program is an example of what we're trying to do. But again, I realize that the numbers are going to come in by the dozens as opposed by the thousands. But I also look at those numbers of people who have died. And overwhelmingly, again, when you see the numbers that 95% of the people who have recently died from COVID-19 either were not vaccinated or were only partially vaccinated, that leads me to conclude that there's no way we can let our guard down, that we have to continue to do this, no matter how difficult it is, because it's that important.
And I couldn't agree with the mayor more. I guess the only thing that I would add to that is the data tells us the story. When you look at the data that we have been collecting and presenting to the community as well. And so we need to make sure that, as the mayor mentioned, that we're having the right people, having the right conversations at the right time to make sure we can get this life-saving vaccines in so many arms as possible. So the work doesn't end for us. Yes, it's going to get tougher. And as the mayor mentioned, it's only going to become a few people by the dozens, but we're not going to let up on this effort to get as many shots in people's arms.
Thank you both. The next question comes from Kent Wainscott with WISN 12. He's asking Dr. Sanchez, regarding DHS saying 95% of COVID deaths and 99% of hospitalizations in the state are of unvaccinated people, do you believe seeing such accurate cases as opposed to projections will help to persuade people who have not been or who have been vaccine hesitant? And do you expect those rates to remain the same or change with the increase in the Delta variant?
Those are really great questions. And I think it's important to understand people who are hesitant or have questions of the vaccine, there may be several variables and distinguishing variables that cause someone to be hesitant. So the drop in the number of hospitalizations and death is a true testament to vaccines and to precautions. There's no questions that vaccines are extremely effective in preventing severe infection and even mild infection or asymptomatic infection. I think a lot of the questions I'm seeing on vaccine hesitant people are in regards to concerns of long-term effects of the vaccine. And all I can do is have an honest conversation like I did an hour ago with my last person. And that is, we know that historically vaccines, if there is going to be a significant side effect, is in those first few days. We have a very robust vaccine adverse event reporting system that picks up severe reactions and things that are extremely rare, including the rare blood clotting events or the issue most recently released in young men with myocarditis. These are extremely rare, and when you put those odds of reactions head to head with severe, long-lasting, well-known, well-described long-term effects of COVID, the benefits heavily outweigh the risks to any of these vaccines. So that's what I'm dealing with personally in clinic, and hopefully some of these numbers in terms of efficacy and safety will continue to entrust the public or inspire confidence of the public and trust of medical professionals.
Our next question is from Rose Schmidt with CBS 58, and perhaps the mayor or the county executive, you might know these. Otherwise, maybe I can circle back with you, Rose, offline if we need to get those numbers. She's wondering, do you have information about how many of the city or county COVID deaths are among people who are unvaccinated versus vaccinated?
I don't have those figures for the city, and I think that's something I don't know if the county has, and we can have the health department get you those figures if we've got them.
I don't have it on me, but we can get OEM to get that information.
All right, so I will follow up with you, Rose, after the briefing. The next question comes from Joyce Garbasiak with WISN 12, and I believe it's for Dr. Sanchez. She says, the World Health Organization is now saying fully vaccinated people should wear masks as variants spread. Do you envision similar advice being advocated by the CDC as cases tick up?
Thank you for that question, Joyce. I think it's very hard to make predictions as it has been for the past 16 to 17 months. The stance of the WHO on advising masks for fully vaccinated people has implications across the globe. We in the US are in a very privileged position. You had heard earlier about some of the quoted statistics. About 60% of adults in the entire United States have had a single dose of vaccine in the US. As I advise personally international travelers, and I look at the statistics of vaccine rates of one dose of vaccine across the globe, it's generally 1% or less in the majority of those countries. So lots of people are still very vulnerable. And now as variants such as the Delta variant, which is much more contagious than the original strain or even the UK or Alpha variant, we're going to be seeing a lot more spread if I had to predict in those highly unvaccinated communities. We are also seeing increases in cases across the US in select areas with locally low vaccine rates. So it's possible, it's not off the table, that the mask guidance may change. I am optimistic by nature and hope that isn't the case, because every day we are still seeing people getting vaccinated, about 600,000 vaccinations per day at the current rate, although that's lower than the 3 or over 3 million per day max that we saw a couple months ago. So again, I also hope that as things come out for children, particularly the children who are less than 12 years of age who are not currently eligible for vaccines, I'm optimistic that that'll come rolling out maybe in the fall or winter or early 2022, and that'll help to get us at a higher level of immunity, because that is in fact how we deal with these variants, and any spreading variants anywhere in the globe affects us locally too, because we are a very interconnected global society. So I don't know the answer to that. I hope not, and vaccines are the way out of this so that it doesn't get to that point.
Thank you. And I believe the next question is for you as well, Dr. Sanchez. And if we need to follow up after the briefing with additional details, we certainly can, but I'll go ahead and ask it. It's from Brian Polson with Fox 6. He says, with regard to the 95% of COVID-19 deaths from March to June in Wisconsin, DHS says there are still 21 so-called breakthrough cases that have resulted in death. Do you know if any of the vaccine breakthrough fatalities have occurred in Milwaukee County? And if so, do you know of any of the circumstances around that? Were they elderly, long-term care residents, immunocompromised? What should fully vaccinated individuals make of the 5% of deaths that have still occurred in those who were vaccinated?
Thank you for that question, and it's an important one because it helps to inform us as fully vaccinated people as far as our own health risks. And some of that 5% can be a little bit misleading here. So when we talk about all cases of deaths in people who are vaccinated, many of those were only partially vaccinated, didn't get the full protection of the immunity. I don't have statistics to quote to you as far as what the age ranges were or how far out of being fully vaccinated of that cohort who was fully vaccinated. But yes, none of our vaccines are 100%. 95% efficacy or around that point does not mean that 5% of fully vaccinated individuals get infected. So I want to clarify that. It's less than 0.001% of people who are fully vaccinated who have breakthrough infections. The majority of those that happen are either mildly symptomatic and resolve, or are asymptomatic and are caught on screening for various other purposes, like an elective procedure, for example, or some work requirement or travel requirement, as we're doing a lot of in our travel health clinic. And so when we see that, it's important to know. It's also important to know that the number of deaths is so much lower than we see in generally people who are unvaccinated. And as you have seen, and Mayor Barrett have alluded to, the vast majority of the people who we're seeing in our hospitals and who are dying of COVID-related complications are in our unvaccinated, unfortunately. So much work to do.
Our next question is for County Executive Crowley, and it comes from Chuck Kornbach with WUWM. He's asking, can you please talk more about people being paid by the Jump at the Sun program? Is this federal money? And has there been a problem recruiting volunteer ambassadors or counselors?
So the dollars that we are giving to support this effort are coming from the CARES Act dollars that we receive, as well as some sources from some of our philanthropic partners. But as it relates to people working on this, I think we always need as many partners, workers, employees to support keeping this community healthy. But we are always going to use these opportunities to promote job opportunities, whether we're talking about with the vaccinations or whether we're talking about buses, parks, or airport.
Thank you. The next question is from Joyce Garbasiak with WISN 12, and it's for the mayor and Dr. Sanchez. She asks, 14 people recently vaccinated before the Bucks game, while thousands filled the Deer District. No masks, no social distancing. Why, in your opinion, do young people seem to be rejecting the science on the necessity of the vaccine?
Doctor?
Great question, and an important one, and reflective of what I'm seeing personally in clinics. And the hesitancy really has been in younger people who are not susceptible to severe disease, unlike the elderly and vulnerable who generally have been waiting in line. I remember back in December when people were very antsy. Like I had said before, a lot of it is concern about what we don't know, because it's been just over a year, and certainly about a year since the phase 2-3 clinical trials were first released in healthy individuals, and so. One thing I have to reiterate is that these vaccines are exquisitely safe, and any side effects we see of the more common ones are self-limited and exceptionally better than getting COVID, particularly that post-acute sequelae or the long COVID that you hear about. We're seeing more of those cases within our health systems here in Wisconsin, and that is a debilitating condition that can cause severe both physical and also mental health disability. So again, I encourage people who are concerned about long-term side effects of vaccines, that these have a great vaccine safety record, and we have a very robust system to detect those rare events that are generally self-limited.
And I think human nature comes into play here. I think for many people in their 20s, it's when they feel like supermen, superwomen, they feel invincible. They brag about how it's been literally years since they've gone to see a doctor. That's all real. That happens in real life. Young people in particular are proud of that. And so you tell them, okay, get this vaccine. Even if you get it, it's not going to have that much impact if you don't get that sick, because the numbers are not as serious in terms of severity of the disease for young people as they are for people who are older. And so it can't be a shock. I think that's where the trusted messenger comes in. That's where the sense of community pride comes in, that this helps everybody, because you don't want to have young people be the ones who are spreading it, because they have older people in their lives, or they have interaction with people who are more frail or have more susceptibility to disease. So it's really a challenge, and it's why we keep working at it as hard as we do.
Thank you both. I'm seeing two more questions in the chat. Both appear to be for Dr. Sanchez. I'll ask the first question, which is from Rose Schmidt with CBS 58. She's wondering, as our vaccine numbers continue to climb, do we have any more indication about when we will reach herd immunity and what percentage we will need?
Oh, Rose, that's $1 million question, right? So I think there's a lot of concern within public health and the medical community that when more contagious variants like Delta are circulating, that increases the bar. There's a calculated equation you may be familiar with called the R naught. That is calculated based on how contagious the virus is. And when we're talking about viruses that are doubly more contagious or quadruple in terms of their level of contagiousness, that raises the bar for herd immunity. This is not an exact science, and it's also not an on and off switch. I think the 70% goal was a good one, and we're getting closer, inching closer by July 4th. Unlikely, but I am optimistic that when we continue to see safety data on, particularly in long term, that'll help reassure a lot of our community that have concerns about long-term side effects of vaccines, prove that that's not a concern, whereas COVID is and new variants are. And we're, again, not going to get over this until we all work together to achieve that immunity. So I don't have a net magic number for you, unfortunately, but as variants that are more contagious continue to spread, that whatever that bar is, that dial does go up.
Our next question is from Allison Durr with Milwaukee Journal Sentinel, and she's wondering, Dr. Sanchez, she says, we've talked over several months about the variants that have been found in Wisconsin. Why have we continued to see low case numbers, even as the county's vaccination rate remains about half per DHS? What role does the amount of the virus spread early in the pandemic play in the lower case numbers today?
Yeah, another great question that we don't have a 100% answer to. And if anyone is able to give you an 100% answer, I'd question what they have to say. The virus wants to do what it wants. So as it continues to replicate, the strains that are selected out will be the ones that are more fit, the ones that populate, replicate more, that infect more, that bind to our nose receptors more. So I don't have an answer for you. I do think there are lots of variables in terms of why things are going down. Vaccines are huge. There is no question in my mind, in the minds of public health experts and medical experts and scientists, that the vaccine rates where we are now, they're great. They could be better and they should be better. So we should strive for that. As far as seasonality, there is some evidence for that. So respiratory viruses, aerosolized viruses tend to go up. As we saw last summer, however, we did see that increase, that uptake in July. So that rule does not necessarily always apply, and SARS-CoV-2 or this COVID virus has surprised us. So there's probably multiple variables and some that we just are still understanding at this point.
The final question in the chat that I'm seeing is for the mayor, and it's from Chuck Kornbach with WUWM. He's wondering, has there been any financial or political pressure on the city by the Bucks or Brewers to increase capacity at games? Any pressure not to confront fans who are not wearing masks at the games?
Well, one of the things that I'm proudest of throughout this 15-and-a-half-month ordeal is that at every point, every decision we have made has been based on the science. And that means that I've gotten pressure from those who thought it went too far and pressure from those who thought it didn't go far enough. And that has happened continuously for the last 15-and-a-half months. But it was really a fail-safe for me to say we're going to follow the science, because we felt that in the long run, following the science and the guidance from the CDC, the guidance from the state, and from our own health department would be the best long-term strategy to fight COVID-19. So no, there has not been any political pressure. Certainly not on me. I can't talk about anybody else, but there has been no political or financial pressure whatsoever. I will point out again that our percent positivity rate still remains in the low transmission category, and it's now at 1.1%. So why is that relevant? That's relevant because there were certain cities in the nation that opened up their games much more expansively, much earlier than we did here in Milwaukee. Again, we did it in what I would call a very step-like process over the last several months. We've had great cooperation from both the Milwaukee Bucks and the Milwaukee Brewers, and an understanding that what we were doing was consistent with public health guidance. And I'm very, very pleased. Again, I look at where we are right now with that low transmission category at 1.1%, and I'm proud of that. I'm not happy that we've seen a slight increase in cases per 100,000, but I think we continue to do this at a very prudent speed. And if things change, we're going to make changes as well.
All right, and a fun way to end today's briefing, Rose Schmidt wants to know if you guys have any predictions, Bucks in 5, 6, or 7?
Bucks in 5.
Bucks in 5.
All right, Bucks in 5. That's the way we'll end today's briefing. Thank you all for joining us, and we'll see you on Thursday.
Thank you all.
Thanks, everybody. Go Bucks.
Go Bucks.